بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. I'm Areej Alfattani, an epidemiologist and biostatistician from King Faisal Specialist Hospital and Research Center, Riyadh. I want to thank Dr. Khalid Sleiman from the Saudi Critical Care Pharmacy Research Group for this invitation, and I'm happy to apply for this invitation and to give this talk. And I encourage their platform of collaboration between researchers. So today I'm talking about how to select the best study design for your idea of research. So let's start right away and see our objectives. We will start with an introduction of an epidemiology, and we will review common study design used in medical literature. We will discuss the advantages and disadvantages of each design, and I will illustrate some of the disease estimate of each design and how to interpret them with some examples. So I hope you enjoy this talk. So what is an epidemiology? The scientific definition of epidemiology is the study of distribution of health outcome or disease within a specific population, and the study of risk factors that determine spread, the health outcome or the disease. So we have a specific health outcomes and with a specific definition, and we are studying this health outcome within population, and also we are studying how risk factors can increase or decrease the outcome. In epidemiology, we use a specific reasoning to study disease. We begin with a suspicion, and this usually comes from the clinical practice or in community or in lab observation, or it could be a theoretical speculations. We then formulate a specific hypothesis. We then apply experiments and collect data and observation and analyze the data. After we have finding, we can compare the finding with the previous knowledge and assess the validity. Then we can draw conclusions and communicate the results with others. In medical research, most questions fall into three categories: either descriptive or evaluative or explanatory. In descriptive, we study incidence and prevalence of the research of the disease or the health outcome. We may study trends, patterns, or we want to assess opinions or knowledge. We also study life history of a disease. While in evaluative research, usually we have to compare between existing and new treatment or therapy. So here we study efficacy or safety of the treatments or preventive programs. And we have always the concept of comparison in evaluative research. While in explanatory research, we used to study the causes of the disease, mechanism for observed processes, or actions or events. And this is an overview map of the study design. Let's review this map together. So the investigator should ask himself whether there is whether he should assign an exposure to the target population or no. If he should assign the exposure, then this is an experimental study because the investigator intervene in the study group and assign some exposures. In the experimental study, is there a random allocation or no? So if there is a random allocation, it will be randomized control trial. If there is no randomization, then it will be non-randomized control trial. And there are many types of non-randomized control trials. While if the investigator will not assign any exposure and he will just observe, then this is an observation study. An observation study, it can be analytical, where it can hold a comparison, and it can be not comparison, only descriptive. If there is no comparison, then we have a descriptive study, and it can be either case report or case series or cross-sectional. If there is a comparison, then we have analytical study, and we have three types of analytical observational studies. The first of them is cross-sectional study. When we study the exposure and outcome at the same time, it can happen in one group or it can happen in two or more groups. But the same concept applies for all, which is to study the exposure and outcome at the same time. The second type of observational studies is the case control group. When we pick the cases based on their outcome and then go back to study their exposure. The third type is the cohort study, when we select the participant based on their exposure and follow them up for some time to collect the data of the outcome. And in this presentation, we will explain all of these types of study designs with some kind of details. So what is the proper design for a research question? Well, it depends on what you are studying. If you are studying therapy or treatment, then the RCT double-blinded is the most suitable study design. It can be a systematic review if you have already found good number of RCTs in the literature. So you may want to review them and make systematic review out of them. Systematic review can follow up with meta-analysis if there is available data to be analyzed. But what if you are studying a diagnosis, like in lab or in radiology? The most study design appropriate for studying diagnosis research is the cross-sectional. And it can be controlled trial, it can be systematic meta-analysis of cross-sectional or controlled trial. But the cross-sectional here is not like the survey type of cross-sectional. It can be done with a specific criteria that suits the diagnosis type of research. If you are studying a prognosis of some disease, then the cohort studies that has follow-up for sometimes is the most appropriate. Case control if the disease is very rare. Case series if you have very few cases or observations of the same disease. If you are studying harm or etiology, same as prognosis, the cohort study are the best. What about prevention? RCTs, of course, are the best. And did you see when the time of Corona, when they invent the vaccines, most of the RCTs were happening in order to see the effectiveness of these vaccines to prevent the infection of Corona. Quality improvement, if you are studying quality of improvement, of course, RCT are the best. Or you can, if you do want to intervene, then cohort are the best. If you are studying opinion or experience, as we said, we use qualitative studies. So this is an overview of how to choose the best study design for your research aim or objectives. So let's start with the qualitative studies. Qualitative studies are common in medical literature. We are focusing today more on the quantitative type of research, but I will give you a quick hint about qualitative studies because it is important. And it can be the only way to study something about knowledge or opinion or perception of some health-related outcomes. So the definition of qualitative studies is it is a strategy for a systematic collection and organization and interpretation of a textual information. So here we have less numbers, but more text. Qualitative methods can generate comprehensive description of processes, mechanisms, or settings. They can characterize participants' perspectives and experience in great depth. Qualitative studies have some protocols and some way of conducting. It's not just random. It's not just a research that pop up in the mind of the investigator and he asks everyone in front of him and collect answers. No, it has to be structured very well. Responses of the qualitative research can be audio or videotaped or put into transcript for the documentation purposes. The data then are coded into categories of similar meaning or criteria. And this is a very hard step. And there are a lot of research on how to do coding for the textual information. The codes then are discussed and negotiated and reviewed more than one time among the research team to conclude the results and came up with a scientific conclusion. There are many study designs in a qualitative, or it can take different shapes. It can be an in-depth interview, like to explore individual experience and perceptions. It can happen as in the form of focus groups to generate a unique insight into a shared experience. It can be as an observational, when the observer or the investigator sit and observe and learn about behaviors and interactions in a natural setting without intervention or without asking. And these usually common in study cultural aspects. Or it can be a document review. One of the examples of the qualitative research that used the document review, that those research based on the tweets, for example, or based on the one of the interaction of the people in social media. This kind of research depend on the responses of the population or the people regarding a specific problem, social problem or political problem. And the investigator try to collect as many as he can from these responses and try to describe the phenomena and the feelings or the perceptions of the people regarding this problem. In the qualitative research, there are some of the disadvantages, like lack of reproducibility. So a researcher cannot exactly do a similar research in a different setting because the people, the research participants might be different, so they probably have different responses. It lacks the generalizability, and there is a bias called researcher bias, and it plays a big role here because the researcher himself, when the way he asks the question and the way he translates the responses of the participants might have a big effect on the qualitative results. There are some examples of qualitative studies. I know that psychological and social research heavily based on qualitative research, but in medical literature also we can use this kind of research studies, like to study the social opinions in health-related outcomes, or to study the patient perception about health access or quality. Or we might want to study the beliefs or motivations of a health behavior. Okay, so here we covered the qualitative studies. Let's move to the observational studies, the descriptive part of the observational studies. But first of all, I want to define very important terms in epidemiology: the prevalence and the incidence. So what is prevalence and what is incidence? The prevalence of the disease is the proportion of the individual in a population who have the disease at a specific point in time. For example, how many obese children in the primary school of Riyadh? So in prevalence, we have cases, and the cases, and we have population, and we collect those cases who have positive disease among the population. So we take the ratio of the people who have the disease divided by the total population in the study. Regardless whether those who have the disease diagnosed yesterday or diagnosed so many years ago, it doesn't make a difference when we study prevalence. On the other hand, incidence of the disease quantifies the rate of new events or cases of a disease that develop in a population at risk during a specific time interval. So we have a specific year, and we count the new cases that happen to be diagnosed during this year. For example, how many new cases of COVID-19 patients diagnosed from December 2019 to December 2020? Notice here that incidence is usually bound to a specific time period, and it takes only the new cases divided by the population at risk. Now, which study design that can help us to estimate the prevalence and which can help us to estimate the incidence? That's what will we see in the next coming slides. In the observational descriptive part of the studies, we have case report and case series. And what is case report? Case report is an article that describes and interprets an individual case. And those cases usually have unique symptoms or unexpected events, or it can happen as a new treatment plan that shows effect on specific patients. While a case series is a collection of case reports. So if I have a very rare case report here and a similar one in another institution and a third one in another institution, then I might collect these three cases and make case series out of them. There is no specific number of individuals that can go under case series. or case report. By the way, case report can take two to three individuals, but case series usually from 5 to 10 or more. But it doesn't reach the sample that usually used for research. And what is the advantages of case report and case series? It helps to identify a new disease and detect a new side effect of a drug. Usually, it is used for educational purposes. However, case reports cannot be generalized because it depends on only few individuals, one or two. And also, consequently, the causes and associations that we can find in case reports and case series, they may have other explanations other than what is explained by the doctor. Also, we cannot depend heavily on these findings unless someone take the hypothesis, generate the hypothesis out of this case and try to validate the results on a bigger population. So let's move to cross-sectional. Cross-sectional, also called ecological studies, it assesses the association between exposure and outcome in groups of individuals at the same point of time. And this is the key information in cross-sectional, at the same point of time. In cross-sectional studies, this is the timeline. Here is the present time, and here is the future. We study the outcome and risk at one point of time by different mechanisms, either by doing a survey of the participant, which is the most common, or by review the charts of the patients, or by collecting an online surveys. The advantages of the cross-sectionals is that it gives the prevalence. As we say, the prevalence is the number of people who have some kind of disease divided by the total participants in the research. So cross-sectional can give us the prevalence. It is inexpensive and fast. Now, nothing is fast in research, but compared to cohort study, compared to other kind of RCTs, cross-sectional considered to be inexpensive and fast. It can establish the hypothesis if there is a relationship between the outcome and risk. We can use it with a common disease and persistent risk factors. The disadvantages of cross-sectional research that it does not give temporal sequence. So we never know whether this association between the risk or outcomes is causal. So which happens first? If I see a correlation between, for example, hypertension and stress, I cannot determine in a prevalence study or a cross-sectional study whether the stress causes the hypertension or whether the hypertensive patient happen to have more stress than others. You see the point? Also, cross-sectional is not suitable for rare or short duration or successfully treated outcomes. For example, influenza is a short duration disease, and it is successfully treated every time with the medication. So if I want to assess the prevalence of influenza in the winter season, for example, cross-sectional will not be the best design because I will not catch all the positive cases of influenza during my study period, probably because patients get positive and then treat it fast, and I could not reach them at that time. So in rare disease, cross-sectional will not help me, because I will have to have very, very large sample size in order to catch these rare events or disease, which is not practical for most of the times. This is an example of cross-sectional. Let's study the association between negative smoking and chronic respiratory disease in Riyadh. And we collected data from 369 participants from 2014 to 2019. Among these participants were surveyed, 37 of them diagnosed with chronic respiratory disease. So the prevalence in this population is 37 divided by the total population with 369, and it happens to be 0.10. So we can say here the prevalence of the chronic respiratory disease is 10% in Riyadh. Is 10% in Riyadh.